In this presentation, I will answer the question, what is cold laser? Specifically, the three questions that I will answer are these. What is LLLT, or cold laser? Is a Class 4 therapy laser a cold laser? And finally, why you should never use the terms cold laser, hot laser, etc. The definition of laser therapy or photobiomodulation is the application of red and infrared laser light to biological tissue with the goals of stimulating cellular processes and enhancing the activation of biochemical mechanisms which induce activation of specific processes that contribute to healing, pain relief, reduction of inflammation, and tissue regeneration. On this slide and in the next few slides, we will draw a contrast between surgical lasers, which cut or ablate tissue, and therapeutic lasers. In the picture, you see a carbon dioxide surgical laser which is cutting chicken tissue. Surgical lasers use a photothermal reaction to cut tissue and have power densities of 1,000 watts per square centimeter or more. The power density is a measure of the concentration of the laser light. Surgical lasers use a very high power density in order to cut the tissues. By contrast, therapy lasers induce photochemical reactions. Now, with the higher powered Class 4 therapy lasers, tissue temperatures may rise 1/2 to 2 degrees Fahrenheit in the treatment area, but there is no tissue heating at lower power settings, and most importantly, the power density of a Class 4 therapy laser, or for any therapy laser in general, is less than 2 watts per square centimeter. Now on this slide and then in the next couple of slides, we will discuss and contrast between high-level laser and low-level laser. These terms came about and were introduced into the literature in the late 1980s. At the top left, you see the carbon dioxide laser, which is cutting the chicken tissue. And then at bottom left, you see a video where that carbon dioxide laser with a power density of about 14,000 watts per square centimeter is cutting the chicken tissue. Now, at right is a chart that shows the different laser tissue effects. In the area in the middle where the laser light is cutting the chicken tissue, indicated by the red arrow, that is where we have the areas of tissue ablation. Very high power densities, very high concentrations of laser light are cutting the tissue. By contrast, outside of that area of cutting is what was called low-level laser. It is off to the sides, and in those areas there is actually biostimulation. Where did the term low-level laser come from? Credit for the creation of this term is given to Dr. R. Glenn Calderhead. He was working with surgical lasers in the 1970s and 1980s. The terminology low-level laser therapy, or LLLT, was first coined by Calderhead and introduced into the medical scientific literature in 1988. The next bullet point is the most important point of this presentation. This term, low-level laser therapy, referred to the reaction at the tissue and not the output power of the laser device. Here is a paper that Dr. Calderhead presented in a journal laser therapy in 1991. The title of the article is Watts a Joule on the Importance of Accurate and Correct Reporting of Laser Parameters in Low Reactive Level Laser Therapy and Photobioactivation Research. So there you see in the title itself, Dr. Calderhead is trying to emphasize that we are talking about the reaction at the tissue and not the output power of the laser device itself. An excerpt of his article is at right where he says, a 50-watt carbon dioxide laser could be used in LLLT with a large spot size. For example, at a spot size of 10 centimeters in diameter, not uncommon in non-contact therapy for large vasculogenic lesions, the power density is 0.64 watts per square centimeter, well within LLLT levels, but that is certainly not a low-power laser. So by our laser classification scheme, a 50-watt carbon dioxide laser would definitely be a class 4 laser. However, in his example, it is being used with a very large spot size, so the power density is very low, and therefore the reaction at the tissue is that of healing and not ablation. In a recent paper entitled Light-Emitting Diode Therapy and Low-Level Light Therapy or Photobiomodulation Therapy, the author stated this: it is important to note that LLLT is commonly and incorrectly thought to refer to the power of the laser, as it is in this guest editorial by linking it to Class 3B lasers. Now let me point out is that this article was a response to an earlier paper that did use the incorrect definition of LLLT. They go on to say, historically, when this term was introduced by Calderhead, it referred to the level of tissue reaction to the dose of light delivered. Thus, LLLT was defined as a dose of light that is below the level of the damage threshold and causes cellular photoactivation. Most importantly, PBMT, which stands for Photobiomodulation Therapy, is not defined by the output power of the device used, but by the effective dose delivered to the target tissue. PBMT is performed not only by Class 3B lasers, both Class 3 and Class 4 devices are being used successfully to treat patients in human and veterinary medicine, alongside other devices based on LEDs. An important advance in PBMT was the recognition that optimization of transcutaneous therapeutic parameters should be based on the photonic dose reaching the target tissue, and that often requires higher doses of light at the skin surface to reach deeper tissues. So to emphasize, the term LLLT refers to the reaction at the tissue and not the output power of the device. As this paper says, Class 4 laser devices are being used to successfully treat patients in human and veterinary medicine, and that in order to deliver a sufficient dosage to deeper tissues, higher doses of light at the skin surface are required. Now, through the years, people have unfortunately misused this terminology. Here you see a chart where they're using the terms hot and cold to refer to the devices. This should not be done. Here we continue with the quotes from the paper that I just showed. Historically, when the term was introduced by Calderhead, it referred to the level of tissue reaction to the dose of light delivered. Most importantly, PBMT is not defined by the output power of the device, but by the effective dose delivered to the target tissue. This paper validates everything that we have said about Class 4 therapy lasers for more than 15 years. To summarize, the term low-level laser therapy, or LLLT, or any other similar term, was originally applied to the reaction at the tissue and not the device. Please do not use the terms hot or cold laser or low-level laser therapy, as they only cause confusion. In my opinion, it is better to say simply laser therapy, photobiomodulation, PBM, or Class 4 laser therapy.